Okay, well, welcome back. It's the 1st of April 2014 when you went to Uppsala in Sweden to learn more about Kangaroo Care. What did you find out when you were over there?
A lot, didn't we?
Yeah, they were so welcoming when we got there. We had somebody assigned to us to show us around. We got the opportunity to speak to staff and parents and observe practices. And we were only there for 2 days really, but in that time we got to get a real feel of what they were achieving and how it impacted on the families that they were caring for.
I think it just cemented how important attachment and bonding is between parents and baby. At that time, it was brilliant, weren't it, what we managed to see?
Yeah, there was one particular family that we observed, and the baby was a 22 plus 5 week gestation baby, born at 340 grams, so very, very small. We observed practice when baby was 3 weeks old. And the family was so confident in caring for the baby, getting the baby out of the incubator, doing skin-to-skin care, feeding. It was a real attribute to what the staff had achieved with the parents in teaching them, and it was a real pleasure to see that they were partners in that care, and that's something that we would really love to achieve at Chesterfield. You know, that ethos of parents being partners in care and supporting them in that role. And since we've come back, we've really already started implementing that, haven't we? We just love to put into place some guidelines so staff feel confident.
And that all parents get the same experiences when their babies come to neonatal unit.
Yeah.
Because I think it's difficult to obviously carry that out when there's no guidance there. Which they did have in Sweden.
Yeah, I think what also it brought us to light that we perhaps don't give enough antenatal information to parents. It's given when the baby's been born, and that time that they've got on the birth centre would be a key time to give them information. We thought about producing an app that they could look on their iPhone or iPads or smartphones. That's something that we'd be really keen in producing, so that parents can look in their own time about skin to skin and perhaps develop it further so it includes other developmental care that the Girls of America have looked at, and perhaps include that as well. In Sweden they had specific types of clothing for mums to wear, like little tubes that the babies fit into so they feel more secure, and we've spoke to our unit manager and she's really keen for us to bring those over, and so they're available for mums to use over here.
We've got some of them on order already, haven't we? So
yeah.
It sounds like you put a lot of thought into what you're going to do here since you've come back from Sweden.
Yeah,
such a short space of time. How difficult will it be to implement that?
Well, I mean, talking to the nurses in Sweden, it's been a 20-year progression from the idea to getting to where they are now. And the most challenging aspect when speaking to the staff were the staff attitudes and the culture change. But I think because we've been given the opportunity to have the travel bursary, we've seen it firsthand and how it affects the parents and the babies, and that's such a positive impact it has. I think perhaps I know it'll be baby steps that we'll take initially.
I think also because the girls that have gone to America will be bringing a lot back as well. I think the unit's just at the moment just quite hyped up into it for the changes that could happen and make care better. So,
and I think everybody's really keen to implement the changes.
Yeah.
It sounds like as well over in Sweden, from what you were saying, that the parents were pretty comfortable in this kind of thing as well. In terms of working with the parents here, is that what it's been a kind of stumbling block, or do they tend to come on board with whatever you...
Well, parents never expect to have a premature baby, and it's a very frightening process. They don't expect the baby to be so small. They don't know how it's going to breathe, if it's going to breathe, and what support it will need. It's a really scary time, and it's down to the staff to teach them and support them and show them that the baby's stronger than they think, and they can have it out for a cuddle, and that cuddle, that skin-to-skin contact is so important for the baby and the family. The mum's bonding and attachment, the breastfeeding, production of breast milk, and helping the baby to settle its breathing down, its heart rate down. Even the tiniest babies, like which we saw in Uppsala, benefit so greatly. And, you know, I'm sure that the staff will get on board with that.
I think if we can focus antenatally as well, not just when the babies come to the unit. So we've spoke to them before the before the admission to the unit, and if we do manage to do the app, I think it's quite current, and I think a lot of people will be quite interested in looking at information and stuff like that on there. So
they'll be better prepared and know what's expected of them as the baby's been born, and they know that they'll be here for quite some time.
So are you glad you applied for the travel bursary?
Oh, definitely, yeah.
I mean, brilliant.
When we did see it online, we never really expected to get it because we're such a specialised area. We thought it'd probably go to some area that had got a bigger through fare of people, but we're so glad that we did get it because I think it'll make such a big difference to families' lives and babies' lives, and I would just recommend it wholeheartedly to anybody that's got an interest. I mean, not only personally does it benefit you, but you benefit in the whole area that you work in.
It's clear to see that it can improve care as well. You can pick things up from different practices, and
yeah, definitely.
Apart from being filmed, it's been a brilliant experience.
Yeah, that wasn't explained to us when we applied.